Hello guys, welcome to our channel. Today we are going to discuss the biochemistry in our program Mission 200 plus. So let's start the biochemistry rapid revision. So the most important and most repeating at least 5 to 6 MCQs from this topic, the very vital topic for the scoring, that is vitamins. Okay, so let's start with the vitamins topic. We have the two different classifications for the vitamins. One is water soluble and other one is the lipid soluble. So what are the water soluble? Vitamin B and vitamin C. What are the lipid soluble? Remember as KIDA. What does mean by the KIDA? Vitamin K, E, D and A. Okay. What is the main differences? These lipid soluble can cross the blood-brain barrier also. And there is a high chance they can be toxic and at the same time they can be deficient. So both features can be seen in the fat soluble. Whereas in the water soluble, you can only see the deficiency in the patients. Okay, this is the one of the other differences. So let's see the active forms of these vitamins. Vitamin A. Okay, vitamin A, we all know the most common, the active form is the retinoic acid. Okay, this is the retinoic acid. And vitamin D, it is calcitriol. Vitamin E, tocopherol. And vitamin K, it is hydroxyquinone. Okay, this is the for the fat soluble. Next, coming to the water soluble, we have B1, that is thiamine. It is thiamine pyrophosphate. Thiamine pyrophosphate. Next, coming to the vitamin B2, it is having the flavin related, that is flavin nucleotide acid. Okay, this one, FAD. Next, B3, it is having the nicotinamide, and B5, pantothenic acid. The coenzyme A is the common one for the active form, coenzyme A, and B6, pyridoxine, and name also having the pyridoxal phosphate, and B7 for the biotin, it will be having the biotin enzyme only. Okay, biotin enzyme bonded. Next, B9 for the folic acid, you have the tetrahydrofolate. Next, B12, it will be consisting of the methylcobalamin. Okay, methylcobalamin. Okay, these are the common active forms for the all the vitamins. Okay, very important question can be asked in the examination. Next, moving on to the deficiencies. So first one, from this picture, directly image based question can be asked from this picture. So on this picture, what is the first thing that you will be getting? So what is this spot arrow mark that is showing here? These are known for the Bitot spots. Okay, these are Bitot spots. And what is this one, guys? This is corneal ulcer. Okay, this is irreversible corneal ulcer, also known as keratomalacia. And this condition is known for the folliculitis, right? Follicular dermatitis. All these features, what we have discussed and seen now, these are classically seen in the vitamin A deficiency, right? These are related to the vitamin A deficiency. And classifications for the vitamin A deficiency is, so the first and commonly, the most common cause for the blindness in the children. So in the less than 5 years children, the most common cause for the blindness is vitamin A deficiency, right? And what is the first symptom? The first symptom is seen in this patient is the night blindness. Okay, night blindness is the commonly seen in this patient. What about the first sign? First sign on the examination, we see the Bitot spot. Okay, this classification can also be asked in the examination. What are the important things? Z2 is for the corneal ulcer, Z3 for the ulceration less than 1/3 or more than 1/3, and XS for the corneal scar and XF for the xerophthalmic fundus. So this condition is known as a xerophthalmia, right? Next, how about if we are what is the treatment that we have to give? So the treatment for this patient is the vitamin A drops only. So how this vitamin A drops is given? So this is given in the international units. Yeah, how in the what basis? So on the age basis, less than 6 months, we are going to give for the patients as a 50 international units. Okay. If it is more than 6 months but less than 1 year, then it will be 1 lakh international units. Okay. Then whatever the more than 1 year to 5 years, then we are going to give for the 2 lakh international units. So this is as a treatment. But when we are in the immunization place, we are going to start this as a general prophylaxis for the all the patient at 9 months. Okay. From the 9 months, we are going to give these vitamin A drops as a national immunization policy. And once upon a time, there is also asked the question, the child is 1 year, but his weight is 8 kgs only. So for this patient, how much we have to give? So for this patient, we have to give 1 lakh only. Okay, 1 lakh only. Because as per even if it is more than 1 year also or equal to 1 year, but the weight is less, we have to give only 1 lakh. Why? Because as we are discussed already, vitamin A can cause the toxicity. So if it is toxic, it can cause the commonly known as a pseudo cerebral tumor. Okay, these condition can be seen. It will increase the intracranial pressure in the patient. So to avoid this toxicity, we are going to give the 1 lakh international units only as a part of the treatment protocol. Next, coming to this picture, this is a classic picture. What is this condition, guys? This is known as a pellagra, and pellagra is seen in the multiple causes, right? Pellagra can be seen in the multiple causes. What are those causes? Commonly, we see in the maize eaters. Okay, those who consume the maize as a primary source of the staple food in the maize eaters or the sorghum eaters. Sorghum can cause these kind of symptoms because one of the amino acid is deficient in that, or it is associated with the carcinoid syndrome. Okay, or it is associated with the carcinoid syndrome. And heart nerve disease as a genetic condition, it can be seen, heart nerve syndrome. Okay, it is a genetic condition related to kidney. And also B6. What is this B6? Pyridoxine. Pyridoxine can decrease this tryptophan. Okay, tryptophan deficiency. So indirectly, if the patient is taking any TB drugs, especially isoniazid, this can decrease the tryptophan and it can trigger the B6 and also B3 deficiency. All this will be caused. So what is the classic symptoms of this pellagra? It will be consisting of the triad. One, the patient will be having the classical symptoms like diarrhea and also dermatitis. Here in this picture also you can see what is this known for the K-cell nexus, K-cell necklace, and these all are the photo dermatitis. Okay, these are the photodermatitis that will be seen. Dermatitis, diarrhea, and memory loss, that is known for the dementia. And if you not treated, that will cause the death in this patient. So this is what commonly known for the pellagra. But and also these vitamin B3 is for the deficiency, but it can be treated as a treatment for the patients of the lipid disorders. Okay, lipid disorders patient, we can give this drug, this niacin as a therapy. Okay, because it will also decrease the cholesterol. And next, coming to the therapy, we have to treat the underlying cause. So if this is maize eaters, restrict the diet, and sorghum also restrict the diet. And carcinoid tumor, remove the carcinoid wherever the growth is present, and heart nerve genetic condition, decrease the tryptophan. The whatever the treatment that we have to give the tryptophan for them, because heart nerve syndrome is a genetic condition. It is untreatable. Whatever the underlying cause, we have to treat these patients. All right. Next, and also this is commonly seen in the alcoholics also. Classical condition can be seen in the alcoholics. Next, here the two picture that you are going to see, one is the blood smear and other one is the neural tubal defects. So by this condition itself, you can understand this is the B12 deficiency and this is the B9 deficiency, and folate and cobalamin. Let's see, both are belongs to what kind of anemia? These both are belongs to the megaloblastic anemia, right? Megaloblastic anemia. Same as the B12, this is also megaloblastic anemia. Which is most common? B12 is the most common for the anemia. Next, what are the causes? In the B9, it is classically associated with the alcoholic patient, but whereas in the B12, it is associated with the vegans and also alcoholic patients. Okay, commonly. Because vitamin B12 is only present in the meat, whereas the vitamin B9 is present in the vegetables also. And when you do the labs for this patient, what happens? Homocysteine, the pathway present in this B9 and B12, the homocysteine will be elevated. And other one, we are going to check the methyl malonic acid. This methyl malonic acid is normal in the B9. Whereas in this patient with the B12, both the homocysteine and also methyl malonic acid is also elevated. These both are elevated. So that's why if the patient is having the B9 deficiency, methyl malonic acid will be normal, whereas B12 that will be elevated. And other causes will be pernicious anemia. Pernicious anemia, where you are going to see this is classically seen in the patients with the history of the GI surgery. Okay, in the GI surgery, where it is commonly seen intrinsic factor, right? So intrinsic factor in the intestine, jejunum, these vitamin B12 will be essential. But if the intrinsic factor is absent and history of the GI surgery, pernicious anemia, that is also replicate the B12. And what are the causes? The complications will be the patient will be suffering from the neural tubal defects. So for them, preconceptionally, we have to give the 4 milligrams of the folic acid as a treatment. Next, what are the tests that we can do for this patient? We can do the histidine test. Okay, histidine test for them, or we can also go for the Figlu test, where this is labs can also be for the differentials. But if it is untreated, it can cause the subacute combined degeneration. Subacute combined degeneration is a major complications for the patients, those who are suffering from the vitamin B12 deficiency. Next one. So this is the another picture. By the picture itself, you can say these are known for the mammillary bodies. So if the mammillary bodies are already necrotized and damaged, what could be this condition? So this is known for the Wernicke's encephalopathy. Wernicke's encephalopathy is again seen in which condition, guys? It is seen in the thiamine. Okay, it is seen in the thiamine, classically in the alcoholic patients. Classically seen in the alcoholic patient. So common other causes will be polished rice, those who are having the staple diet for the polished rice. So this can cause the other condition that is known as a beriberi. And this beriberi is two types. One is heart related and other one is the brain related. So heart related will be always the heart is full of the blood. So it can cause the wet beriberi. And in the patients with the brain or the neurons, so that will cause the dry beriberi. Okay, both will be having the very detrimental of the prognosis for this patient. Next, alcoholics we discussed, and alcoholics will be associated with the Wernicke's encephalopathy. What are the symptoms for them? Remember as a GOA. What is this GOA? Global confusion. Okay, we already discussed in the yesterday lecture that mammillary bodies for the memory, and mammillary bodies are already necrotized, that can cause the global confusion. And also ophthalmoplegia. Okay, ophthalmoplegia and ataxia. Okay, these are the commonly seen in the Wernicke's encephalopathy. If you untreat this, if you are not treating properly, then it can cause the Korsakoff syndrome. Okay, then it will cause the Korsakoff syndrome. And this Korsakoff can cause the amnesia, retrograde amnesia, and also confabulation. What is this confabulation? Is known as if the patient does not remember that particular episode, he is going to replace with some other story. He will replace with some other, whatever comes to him mind, he will replace that story. So this is known for the confabulation. All right, next B2. Okay, here you can see this is the B2 deficiency. What are the classical symptoms? Glossitis, chiliosis, and itching and burning in the eyes. Okay, these are the commonly seen with the riboflavin deficiency. And next, coming to the here, the another picture that you have to remember, what are the tests or the assays that we have to do? For the B1, we can go for the RBC transketolase assay, and B2, RBC glutathione reductase. For the B6, RBC transaminase, and for the B9, it is FIGLU or the histidine load test. B12, serum methyl malonate level, because it will be increased. These are the tests and the that we can do for this patient. Next, coming to the B6. Okay, B6, we know this is for the pyridoxine, and this is important. Not only that, you have to remember B6 is important for the transamination. For the amino acid, the transamination can be done by this, and also it is important for the heme synthesis. It is important for the heme synthesis. It is also important for the non-oxidative decarboxylation. And what about the oxidative carboxylation? That will be done by the B1. But these three important roles will be done by the B6. Then what could be the causes? The causes will be TB drugs or genetic diseases, or patient is having the sideroblastic anemia. These also caused by the B6 drug only. Okay, due to the deficiency. These will be done. But if it is very toxic, what it only the water soluble drug that will cause the toxicity. And at the same time, it will be showing the deficiency also when it is a low level. Or both symptoms will be presented as a peripheral neuropathy. Okay, both will be presented as a peripheral neuropathy, and you have to rule out the other causes of this patient. Next, what is this condition, guys? This is a classical condition, right? This is known for the scurvy. Scurvy is known for the unforgettable disease. Nowadays, scurvy is rarely seen, but still it is present in our society. What is this classical condition? And same, this PTK, all this perifollicular PTK, all this is commonly seen in the patients of the scurvy only, because scurvy is deficiency of the vitamin C, right? It is deficiency of the vitamin C. Vitamin C is decreased. Collagen is also going to decrease because it is important for the hydroxylation. So collagen synthesis is decreased. This will cause these kind of symptoms. Like, what are those symptoms? Bleeding gums, right? Bleeding gums is seen in this patient. Gingivitis is seen. And PTK. These PTK will be perifollicular PTK. And also bone mineralization will be decreased. And subperiosteal hemorrhage will be also seen. And patient will be having the poor wound healing, because again, the collagen is decreased in this patient. And anemia is also seen because iron absorbs very good with the vitamin C. If the vitamin C is decreased, it can cause the anemia, right? This is classically seen again in the children. Next, coming to the another picture, this is the vitamin D, right? Vitamin D. Before the vitamin D, you have to take note of this point. The vitamin D cycle. How we are going to get the vitamin D? From the sunlight. From the skin, the 7-dehydrocholesterol is going to reach the liver, where it is going to convert as a cholecalciferol. Okay, cholecalciferol as a vitamin D3 derivative. And from there, it is going to convert in the kidneys with the help of the 25 hydroxy vitamin D3 as a biologically active 125 1,25 dihydroxy vitamin D3. This is known as a calcitriol. Okay, this is known as your active form calcitriol. This is the pathway for the vitamin D. And next, coming to the symptoms. How these symptoms are going to presented? Usually, this patient will be deficient of the sunlight. Okay, usually it could be sunlight, or it can be due to the direct role of the vitamin D deficiency, or patient is suffering from the some of the malabsorption or the intestinal disorder. And even in the adults also, this can be seen in the kidney or the liver disease, because here you can see the liver and kidney is playing the major role in the vitamin D. This can be also caused, or the phosphate rickets. This is a genetic condition. These phosphate rickets can also cause this condition. So these are the one of the choices. What is the defect in this? Especially here you can see the again mineralization is defected here. The normal bone you can see, whereas the poor, the mineralization is showing this kind of fragile bones in the vitamin D deficiency. This rachitic rosary and enlarged epiphysis and craniotapes, frontal bossing, all this will be seen, and bowing law of the legs also seen. And commonly these patients will be having the valgus and varus and also Windseft deformity. All these will be seen in this patients as a long-term complications. On X-ray, you will be seeing this condition like cupping, splaying, and the fraying, right? This fraying and cupping and also spraying. These all splaying, all this will be seen, and widening of the growth plate will be seen. This is the classically seen in this patient. Next, how about the laboratory findings? On the laboratory findings, calcium will be decreased, phosphate will be decreased, and there will be increase of the parathyroid hormone to for this one. This classification, it is trying to increase. And also, along with that, there will be ALP is also increased because of the involvement of the bone. What is the treatment? That is, we are going to give with the Strauss therapy. This Strauss therapy will include the vitamin D as a primary adjunctive as per the treatment. All right. These are the conditions that you have to remember for these patients of the vitamin D, vitamin C, and all these conditions. Okay. Next, before we move on to the next diseases, I want to explain you about the most important topic, that is the amino acids. Okay. Amino acids classification. Let's see. The simple amino acids. Okay. The simple amino acids are glycine and alanine. And branched chain, we know this is the leucine, valine, and isoleucine. These are the branch and those are the simple. Next, sulfur related. Okay, sulfur containing amino acids are the most common is the cysteine and methionine. Methionine. Next, non-polar. Okay, non-polar are your branched and alanine and proline and also methionine. These are the polar, non-polar, and remaining all are non-polar only. Next, ketogenic. Okay, next ketogenic. This is leucine and lysine. Okay, and glucogenic plus ketogenic. Remember this way, glucogenic and the ketogenic are the phenylalanine, isoleucine, and tyrosine. Tryptophan. These are for the glucogenic and the ketogenic. So remaining all other are going to be the glucogenic types. Next, essential and the non-essential. Essential and non-essential. What are the essential? Methionine, lysine, leucine, valine, tryptophan again, and phenylalanine, isoleucine. Okay, these are the essential, and remaining all are going to be the non-essential. Next, acidic and the basic. Acidic amino acids are ends with the acidic, aspartic acid, and glutamic acid. And the basic one are your histidine, arginine, and lysine. These are the basic type. Next, last one, aromatic type or the phenylalanine, tyrosine, and tryptophan. Okay, tryptophan. These are the aromatic types. Okay, these classification, this can be asked in the examination. Okay, don't forget to read this and revise this compulsory, this essential and non-essential and other types of the condition. Next, moving on to the inborn errors of the metabolism. Why this topic is very important? Here you can see the picture itself showing the black urine disease, and also this is for the onchronosis. And what is this condition, guys? This is known as a alkoptonuria. This is alkoptonuria. What is the enzyme that is deficient here? Homogentasic acid. Homogentasic acid oxidase. This is the deficiency for the patients of the alkoptonuria, also known as your black urine disease. Whereas onchronosis is also other name. Only the black color of the pigmentation will be deposited in the spine, knee, and bone regions on the cornea and also on the ear tragus and the pinnae. Okay, when the urine is exposed to the oxygen, it will be converted as a black color of the urine. And for this patient, there will be high chance that the patient will be damaging the knee and spine. We have to treat and treat the underlying cause for this patient. Next condition, this is known for the albinism, classical condition of the albinism. And in the albinism patient, what is the deficiency, guys? Tyrosinase. Tyrosinase is the deficiency. It will involve the skin. This is the condition of the tyrosine. This is known as a vitiligo. Okay, this is known as a vitiligo autoimmune condition. Whereas this one only the genetic condition. Completely hair, including the hair, everything will be as a tyrosine deficiency will lead to hypopigmentation. It will involve the classically oculocutaneous. So both the skin and also eyes is also involved in this patient. Next, this condition, imagine this condition is a most common, okay? The clue is this is the most common worldwide inborn error metabolism. This condition is known as a phenylketonuria. Phenylketonuria. What is the enzyme that is deficient, guys? Phenylalanine hydroxylase. This is deficient in this patient. And this is commonly known in the children only, right? But in the adults also, this can be seen where the patients, those who are taking the less phenylalanine or the other derivatives that can also cause. So when the phenylalanine hydroxylase is deficient, so there is a production of the other substances. For example, phenyl lactate can be produced more, and also phenyl acetate and phenyl ketones. Okay, all these will be leading to what condition? Phenylketonuria. So there will be irreversible mental retardation in the patient. Along with that, limb spasticity and decreased melanin production. And other one is the musty odor urine. Okay, musty odor urine and the and also sweat that will be seen as a musty odor in this patient. And worldwide, this is the most common. But if the examiner is asking most common inborn error in the India, then it is medium chain acid deficiency. Okay, medium chain acid deficiency, that is the most common one in the India. Okay, these are the things that you have to remember. Next, coming to these two pictures, the image you have to understand. The one is this is known as a Marfan syndrome, and this is known as a homocystinuria. Okay, homocystinuria. So let's see the differences. This is the autosomal dominant and this is the autosomal recessive. This is related to the fibrillin gene deficiency. Okay, it is a genetic condition, fibrillin gene. And this is related to the enzyme, the cystathione beta synthase is the deficiency in this patient. What are the common symptoms? Both the patients will be tall, and also patients will be having the defects with the skeleton, bone. The bone is also affected in the both condition. Whereas when it comes to the mental retardation, you don't see the mental retardation in the Marfan syndrome, whereas the homocystinuria is presented with the mental retardation. And the lens will be Marfan fan, so upward and temporal lens dislocation is seen. Okay, lens dislocation. And in the patient, urine downward and nasal side, the lens dislocation is seen in this patient. What about the involvement of the heart? So these patient will be having the mitral valve collapse and also aortic regurgitation. So aortic regurgitation, aortic dissection. And these patient will be having the early atherosclerosis due to damage of the vessels. Okay, these are the things that you have to remember. Next, what test can be differentiated? So cyanide nitroprusside test that we conduct. Cyanide nitroprusside test we are going to conduct, and these tests will be negative in the Marfan syndrome, whereas in this patient the cyanide nitroprusside test will be positive. And the next condition is the galactosemia. So from the picture itself you can see what is this classical condition. This is the galactosemia. The symptom is oil drop cataract, and only this oil drop cataract among all the cataracts is reversible, right? It is the reversible. What is the deficiency that is present in the galactosemia? The enzyme is the GALT. Okay, galactose 1 phosphate uridyl transferase is the most commonly associated with the classical galactosemia. Along with this one, and also patients will be presented with the hepatomegaly. Okay, hepatomegaly and hypoglycemia, decreased glucose levels. These are the symptoms that will be presented in this patient. And these galactosemia patient, they are highly prone to E. coli. Okay, they are highly prone to E. coli, so they can be die with this E. coli also. So that is the common one. And also we have the other conditions. Some of the other conditions, let's see here. One among them is the lactose intolerance. Okay, lactose intolerance. This is not an inborn error metabolism, but from the childhood itself, there will be a lactose. This lactose is not going to break down. Okay, lactose is not going to break down. Instead of that, so this will be causing the diarrhea in the patient. Okay, it will cause the watery diarrhea and abdominal pain, and highly sensitive for the dehydration and death. So that's why this lactose intolerance can be seen in some of the patients. All right, next, branched chain disease. Okay, branched chain disease. Now we are going to see what is this branched chain disease. That is maple syrup disease, right? Maple syrup urine disease. This is deficiency of the branched chain amino acids. What are those branched chain amino acid? What we discussed: leucine, isoleucine, and valine, right? Leucine, isoleucine, and valine. These three are deficient in this patient. What is the enzyme that is deficient in this? Branched chain keto acid hydroxylase. This is the commonly associated deficiency in the maple syrup urine disease. And these patients also presented with the mental retardation due to these leucine and valine as a culprit for this patient. Next, other one, thyrosinemias. Okay, thyrosinemias. What are the thyrosinemias, guys? Type 1 is the hepatorenal syndrome. Type 1 is the hepatorenal disease or the syndrome. This is deficient with the fumarate acetoacetate. Fumarate acetoacetate. Type 2 is oculocutaneous, and it is associated with the classically tyrosinase transaminase. Tyrosinase transaminase is the deficiency. Next, type 3, very rarely seen. It will be associated with the newborns, PHPP dioxygenase. Dioxygenase as a enzyme deficiencies. These are the thyrosinemias. Next, coming back to the next picture. What is this condition, guys? Let's say this patient is a child less than 5 years old. This patient having these kind of bruises and lacerations or the abrasions, whatever you say. And this patient will be also having the nail deformities and lip deformities. These both and in the childhood associated with the what condition? This condition is known as a Lesch-Nyhan syndrome. Okay, associated with the HGPRT deficiency. HGPRT deficiency. Increased uric acid due to purine metabolism dysfunction can cause the mental retardation, gout, and also self-mutilation kind of behavior in this patient. Okay, these are some of the important things that you have to know in the inborn errors of the metabolism. Next, moving on to the basic things. Okay, what is this one, guys? This is the oxidative phosphorylation. In this oxidative phosphorylation, ultimate goal is to produce the ATP. But in this process, what happens? There are 5 different complexes. And in these 5 different complexes, there will be some of the things that can be damaged or the inhibit the production of the ATP. What are those important parameters that can cause the completely damage this oxidative phosphorylation? Let's see the examples. For the complex one, the most commonly it is associated with the biguanides. Okay, metformin, this drug is also one of the biguanide. And rotinine, this rotinine fish poison can also cause. And pyridine, okay, pyridine, this can be also caused. Other one is the barbiturates. Okay, barbiturates can damage the type as a complex one. Next, complex 2, malonate, complex 1, malonate and carboxyl. Complex 3 is associated with the antimycin inhibition, antimycin or BAL. This BAL is a British associated one, right? And this is we use commonly for the antidote for the some of the poisons. This can be done. And next, fourth one, complex 4, that can be inhibited by the cyanide, hydroxy sulfide, and also carbon monoxide. And the complex 5, oligomycin. Okay, these inhibitors can be also asked in the examination. Next, other one is also presented. Those are known as a physiological uncouplers. Physiological uncouplers. What are the physiological uncouplers? The first one is the temperature. So thermogen is the most commonly uncoupler for the production of the ATP. Next, another T, thyroid. Okay, increased thyroid, basal metabolic rate will be increased. That can be also physiological uncoupler. And increased bilirubin in the body can also cause the metabolism disturbance. Increased lipids, all these are going to be the physiological uncouplers. Next, coming to the important part, this can be direct question also. Gluts and their what are the organs their content. Next, see, glut 1 will be present in the blood-brain barrier, heart and the blood, RBC. Okay, RBC also seen with the glut 1. Next, glut 2 is seen in the liver, pancreas and the small intestine. Next, glut 3 will be present in the brain, neurons and sperm. Glut 4 is present in the skeletal system, adipose tissue and heart. Glut 5 will be associated with the fructose transporter is seen in the intestinal epithelium. Okay, insulin independent or glut 1 and glut 2 and glut 3. Glut 4 is the insulin dependent. Okay, remaining all can be important and asked in the examination. Next, coming to the glycosaminoglycans. This is also important part. Heparan sulfate. These heparan sulfate is seen in the kidney basement membrane. Okay, it is seen in the kidney basement membrane. Next, chondrion sulfate. This is seen in the cartilages. Okay, C for chondrion, chondroitin sulfate seen in the cartilages. Next, keratin sulfate. This is seen in the cornea. Dermatan sulfate is seen in the skin vessels. It is commonly seen. Hyaluronic acid seen in your synovial fluid and also vitreous humor of the eye. Vitreous humor of the eye is also seen. Next one, LDH. LDH is seen in the first LDH1 is seen in the heart, second LDH seen in the red blood cells, and third LDH3 is seen in the lymph tissue, lungs and platelets and pancreas. LDH4 is seen in the liver and skeletal muscle. LDH5 is also seen in the liver and skeletal muscles. Okay, this one. Next, some of the things that you also have to remember. Direct points. What about the histidine? Okay, histidine. Histidine can work as a biological buffer. Okay, it will work as a biological buffer. Next, glycine have many properties. Glycine have many properties. What are those important pathways? Glycine involved in the creatinine synthesis. It will be involved in the creatinine synthesis. Also, it will be involving in the collagen synthesis. Collagen synthesis, heme synthesis, and neurotransmission. It is a simple amino acid, but it will be having the many importance like creatinine, collagen, heme, and also purine synthesis. Many pathways will be interlinked with the glycine. Okay, and glutathione synthesis. All this will be important for the glycine synthesis with the help of the glycine. Next, moving on to the collagen. So, collagen, we all know that this is the most abundant protein in the body and which will be having the important key role of the vitamin C, right? Vitamin C. What does the vitamins will C? It will be helpful in the hydroxylation of the glycine and proline. So this is the one property of the vitamin C as an important role for the collagen. Next, there are the four types. Remember with the mnemonics cap. Type 1 is seen in the skeleton, type 2 is seen in the cartilage, type 3 is seen in the arteries, type B, that is fourth one seen in the basement membrane of the kidney. Right? Type 1 is the most common seen in the bone along with the skin, tendons, and dentines and fascia. And after the wound repair, after the injury, type 1 will be replaced by the type 3. Okay. Early you are going to see the type 3, but this will be replaced by the type 1 of the collagen. And if it is deficient, what does it will be seen as a osteogenesis imperfecta. And what are the symptoms? Blue sclera, dentinogenesis imperfecta, and joint hypermobility. This is seen in the osteogenesis imperfecta COLA1 gene mutation. Next, second one, type 2 seen in the cartilage, and it will be cartilage, any diseases related to the cartilage dysfunction will be seen with the type 2. And also another part, vitreous body will be seen with the type 2 collagen. Type 3 collagen, blood vessels mainly. So, if the patient is having the Ehlers-Danlos syndrome, that will be associated with the blood vessels disturbances. So, highly this patient will be having the arteries dysfunction. So, high chance that patient will be died by the atherosclerosis or the aortic dissection, or patient will be having the myocardial rupture. So, this will be seen with the Ehlers-Danlos syndrome. Next, type 4 will be associated with the what condition, guys? Goodpasture syndrome and the Alport syndrome. And Alport syndrome, if we remember immediately Alport syndrome, this will involve the kidneys and also SNHL, the sensory neural hearing loss, and anterior lenticonus. Okay, anterior lenticonus. This is what your basement membrane and the Alport syndrome. Goodpasture syndrome, it will involve the kidney glomerulonephritis. Along with that, it will also involve the lungs. Both organs will be involved in the type 4 collagen dysfunction. Next, rate limiting steps of the important pathways. So here you can see the glycolysis. The most important one is the phosphofructokinase, and the glycogenesis, glycogen synthase, glucogenolysis, glycogen phosphorylase. And next one, urea cycle, the most important one is the carbamyl phosphate synthase. Ketogenesis, Hmge co-synthase, whereas cholesterol synthesis will be reductase. Okay, see the differences. and TCA cycle isocitrate dehydrogenase. HMP shunt will be G6PD. Okay, all these points are very important for the understanding in the direct MCQ from this table can be asked. Next, coming to the lysosomal storage disorders, all are going to be the autosomal recessive except Fabry disease and the Hunter disease. Okay, Fabry disease is a X-linked recessive. Next, what is the most common among all these? The most common is the Gaucher disease. This will be deficient with the glucocerebrosidase. Gaucher cells, lipid-laden tissue paper-like appearance will be seen. This is the tissue paper-like appearance that is seen with the Gaucher disease. Tay-Sachs, this is the most common cherry red spot. Okay, this question is also asked in the previous examination. This is most commonly seen multiple, like it is seen in the Niemann-Pick, it can be seen in the metachromatic, but most commonly seen in the Tay-Sachs only. The deficiency is the hexoaminase. Niemann-Pick, sphingomyelinase. Krabbe, galactocerebrosidase. And metachromatic leukodystrophy, arytyl sulfatase. Next, glycogen storage disorders. The most common one is the von Wienerberg disease. Okay, and only lysosomal associated glycogen storage disorder is the Pompe disease. Pompe and pump. So related to the heart, this will be most commonly death will be seen with this patient. Next, Anderson, remember this way, C for Cori, D for debranching enzyme, A for Anderson, B for branching enzyme, myocardial myocardial and myosyl glycogen phosphorylase. Her's disease, liver glycogen phosphorylase disease. Enzymes and what are the important points that you have to remember. Next, lipid disorders. In the lipid disorders, the most common will be type 1 familial hyperchylomicronemia and type 2 is the hypercholesterolemia. The name itself telling chylomicronemia. So elevated chylomicrons. Hypercholesterolemia, increased LDL levels. This beta lipoproteinemia, all the important remnants will be elevated in this one. Okay, very rarely seen. Sorry, this is the most common, guys, not. So hypercholesterolemia, familial hypercholesterolemia will be most commonly seen. This patient will be increased risk of the pancreatitis because of highly these lipids are involved. Okay, this is the picture of the von Wienerberg patient. This is the hepatosplenomegaly. Next, here are the examples that you have to remember. Autosomal dominant disorders. What is the no skipping of the generation and incomplete penetration? Here you can see the generation 1 involved, generation 2 from this father, again generation 3 and again generation 4. So there is no skipping of the generation is seen in this patient. Whereas incomplete penetrance, okay, incomplete. Here you can see one of the parents will be involved and also children will be involved. And variable expressivity, we cannot predict that this child is not involved, this child is involved here. So that can be variable expressivity. Next, autosomal recessive. In the autosomal recessive, the mostly it is containing the enzyme defects only. All we discussed inborn errors now are the enzyme defects only, and usually only seen in the first generation. Here you can see one of the generation will be skipped. So this patient is having the disease. So he will be the diseased person, but he is the carrier. Okay, same as here, carrier, but this patient will be having the disease. So if the both consanguineous marriages, so those who get the consanguineous marriage, highly risk for the both children. That is seen in the autosomal recessive. X-linked dominant, this is transmitted only for the from fathers to the daughters. X-linked recessive from mothers to sons. Okay, to son. This is what seen in the X-linked recessive. Next, other one, mitochondrial inheritance. What is this mitochondrial inheritance? Only from mother to son. Only from mother to son. This is seen in the mitochondrial inheritance. Next, these are also commonly asking question, guys. What is this? Mucopolysaccharidoses diseases. So the most common one is the Sanfilippo, and other disorders commonly asked in the examination is the Hurler and Hunter. Remember how Hunter will be having the problem with the eyes. Okay, usually the Hunter will be have problem with the corneal. Okay, hurler will be normal cornea. So even though hunter needs eyesight, but he will be associated with the corneal defect, and this is also X-linked recessive. And what are the things that you have to remember? Keratin sulfate, dermatan sulfate in the hurler, and dermatan sulfate in the hunter. Okay, these are the points that you have to remember. And mental retardation is seen in everything except Marquio. Marquio, we cannot see the mental retardation. Next, last topic that we are going to discuss, minerals and their deficiency. Before that, we have to know about some of the important enzymes. So, what is the zinc will be important? Zinc is important for the carbonic anhydrase. Okay, carbonic anhydrase. And also alcohol dehydrogenase. Alcohol dehydrogenase. And cytosolic S40. These are associated with the zinc. Next, for the copper, there will be lysylyl oxidase, and cytochrome C oxidase, and also dopamine beta hydroxylase. Okay, these are one. And also superoxide dismutase. Next, molybdenum is seen with a xanthine oxidase. Chromium is important for the glucose. Okay, chromium is important for the glucose. Next, manganese. This manganese is for the kinase and also mitochondria. Magnesium, again kinase, mutase, and enolase. These for the magnesium. Next, we also I forgot to mention about the important points of the breakdowns of the carbohydrates. So, when you break down the maltose, there will be what are the monomers, guys? Glucose plus glucose. Okay, this will form the glucose plus glucose. When you break the lactose, this will give the galactose plus glucose. Lactulose, this will give the galactose plus glucose. Okay, next, what about the sucrose? It will give the glucose plus fructose. Okay, these points can be asked. Next, isomaltose will be also contains the glucose plus glucose. These are the points that you have to remember. Next, from this picture, what is this condition, guys? This is known as a acrodermatitis enteropathica. Acrodermatitis enteropathica. So classically is a genetic condition associated with the zinc deficiency. So anal and also oral lesions will be seen. Along with that, this patient enteropathica diarrhea will be also classically seen in this patient. Next, this condition is known as a Menkes disease. Okay, this is condition of the Menkes disease. What does Menkes disease? Kinky hair. This kinky hair is classically seen in the Menkes disease. And this condition, you can remember, this is the classical condition of the Wilson's disease. This is the KF ring. So, when we put the two things, the Menkes disease and the Wilson's disease, what is the deficiency? Menkes disease is the X-linked recessive. Menkes disease is the X-linked recessive disease and associated with the ATP7A gene. Okay, ATP7A gene. And this is associated with the ATP7B gene. Okay, ATP7B gene. Menkes disease, usually the copper is decreased here, whereas here the copper will be accumulating here. Due to other one, the ceruloplasmin playing the major role here. And it will involve the CNS, basic basal ganglia is involved in this patient. Okay, this will be CNS, and also ultimately this patient will be having the liver failure. Okay, cirrhosis is seen in this patient. Next, this patient, the Menkes disease, commonly associated with this kinky hair and also hypotonia and seizures. This is the Menkes disease. Usually in the early childhood only, the patient will be dying. Next, from this picture, I hope most of you are not familiar with this picture. This is known as a Zellweger disease. Okay, Zellweger, due to deficiency of the peroxisomes. What are the organs that will be involved? Hepato, renal, and cerebral. Okay, all these systems will be involved in this patient due to peroxisomes deficiency. And other one you have to remember, Refsum disease. Okay, Refsum disease due to increased, so there will be increased phenetic acid defect. So pitenoyl coenzyme oxidase will be defect in this patient. Okay, same as a peroxisomes. This is also associated with the peroxisomes. Oxidation will be decreased. Decreased alpha oxidation will be associated. So these are the important points and diseases that you have to remember. Most of the biochemistry will be only the pathology rather than mugging up the facts. Okay, most of like a internal medicine only. Read this chapter and practice the MCQs regularly. So those who are new to this channel, please do subscribe and share with your friends, and don't forget to read and practice the biochemistry. Okay, it will be giving the most importantly scoring in the paper one. Thanks for joining this session. Until then, see you. Bye. Happy learning, guys.